Gentlemen, you've probably seen the buzz, whispers across the internet, conversations in men's health forums, even from friends, claiming there's a simple natural secret to shrinking an enlarged prostate. It often involves a humble bottle of castor oil and a specific spot. The idea is tempting, isn't it? A natural remedy, easily applied, promises to turn back the clock on bothersome symptoms after 60. I'm Dr. Christina Morgan, a urologist, and today we're cutting through the noise. I'm going to tell you exactly where this spot is, discuss the truth about castor oil's potential for comfort and localized wellness, and most importantly, guide you through what science truly says about managing an enlarged prostate effectively. This isn't about chasing myths. It's about empowering you with real, actionable knowledge for profound, lasting vitality. If you're ready to separate fact from fiction and take proactive control, then stay with me. This is you. If this message already resonates with you, if you feel that spark of recognition or curiosity, type 1 in the comments below. If not, type 0. The problem, BPH, the aging prostate and the quest for natural relief, plus microstory. Your feedback means a lot. It helps me serve you better every week. Gentlemen, as we age, specifically after 60, our prostate gland naturally grows. This is incredibly common, and it's called Benign Prostatic Hyperplasia, or BPH. It's not cancer, but its symptoms can be incredibly disruptive. Those frequent trips to the bathroom, especially at night, a weak urine stream, the feeling that you can't quite empty your bladder. These symptoms steal your sleep, your peace of mind, and frankly, your overall vitality. Because of this, many men, quite understandably, seek out natural, less invasive paths. They yearn for something simple, something they can do themselves away from pills or procedures. I've seen it countless times in my practice. I recall a patient, George, a spurry 70-year-old who tried every supplement and natural trick under the sun, desperate to avoid medication. He even asked me about castor oil after understanding castor oil, where the spot is and what it actually does, seeing a video online. His search for natural answers was heartfelt, born from a desire to feel strong and independent again. While his approach was admirable, his understanding of what actually works for BPH was often incomplete. This yearning for natural solutions is real, and it's why we need to discuss topics like castor oil with absolute honesty and clarity, ensuring you're empowered with effective science-backed choices while still exploring how natural approaches can play a role in supporting your overall well-being. So, let's address the elephant in the room, this spot for castor oil. When people talk about applying castor oil to address prostate symptoms, they're typically referring to the lower abdominal area, specifically over where the bladder and prostate would be situated. The idea is to create a castor oil pack. You'd soak a cloth in warm castor oil, place it on this area, cover it with plastic wrap, and apply gentle heat for about 30 to 60 minutes before sleep. Now, what is castor oil actually known for? It's a thick vegetable oil with ricinoleic acid believed to have anti-inflammatory and analgesic properties. When applied topically, it's often used in natural health circles to support localized circulation and detoxification on the skin, and many report a feeling of comfort and relaxation from a warm castor oil pack. This can soothe general discomfort in the area, potentially helping you relax and sleep better. However, and this is where clarity is paramount, despite these localized benefits, there is no scientific evidence to support the claim that applying castor oil to the skin can shrink an enlarged prostate or directly improve urinary flow related to BPH. Its benefits are primarily topical and related to comfort. It's not a treatment for the underlying physical enlargement. It's important we understand that distinction so you're not chasing an elusive solution. So, while that natural, real solutions for an enlarged prostate, the science-backed path to relief curiosity about castor oil is completely understandable, and it might offer a little comfort, it's vital we now focus on what truly works, what science confidently stands behind to give you real lasting relief and peace of mind. This is where your power truly comes from, gentlemen. First, let's talk about empowering lifestyle choices. These are simple, consistent changes you control, and they can make a profound difference. Think about your daily habits, starting with how and when you hydrate. By being mindful of caffeine and alcohol, especially in the evening, you can dramatically cut down on those nighttime bathroom trips that interrupt your precious sleep. What you put on your plate also truly matters. A diet rich in vibrant fruits and vegetables full of good healthy fats, while easing up on processed foods and heavy red meats, genuinely supports overall prostate health and vitality. And yes, staying active. Regular exercise not only helps manage your weight, but also reduces inflammation throughout your body, keeping your whole system, including your prostate, healthier and happier. Don't underestimate the power of simply strengthening your pelvic floor muscles, those you use to stop urine midstream, because these can give you better bladder control and reduce annoying dribbling. I had a patient, Mark, a retired teacher, who simply by adjusting his evening fluid intake and starting daily walks went from waking 5 times a night to just once. That's tangible relief purely from choice. Sometimes, gentlemen, these lifestyle adjustments need a little more help. And that's where modern medications come in, and they are incredibly effective. There are very effective treatments specifically designed to manage BPH symptoms. For instance, some of these medications work by simply relaxing the muscles around your prostate and the bladder neck. It's like gently loosening a knot, making it much easier for urine to flow through. Others actually work overtime to help shrink the prostate itself. They do this by carefully blocking a hormone that encourages prostate growth. So with consistent use, patients often see a noticeable difference in size, which in turn alleviates that pressure on your urethra. Another patient, David the Fur, was initially hesitant about medication, but after his doctor prescribed a simple pill, within weeks, his stream was stronger and that constant urge disappeared. He told me, "Dr. Morgan, it felt like I got my evenings back." Then for those situations where lifestyle changes and medications aren't quite enough to provide the profound relief you need, we have incredibly advanced, often minimally invasive procedures and even surgical options. These aren't the daunting surgeries of the past. Modern techniques are precise and focus on your comfort and rapid recovery. Newer procedures, for example, can gently open up that narrowed urinary channel with very little downtime. For more significant blockages, there's a tried and true procedure where we carefully remove just the excess prostate tissue that's causing the problem, helping to restore a strong, clear flow. These advanced options offer genuine long-term relief when it's truly needed, and they are becoming safer and more accessible every year. But through all of this, gentlemen, my absolute strongest recommendation remains. You need to keep that open line of communication with your doctor, and specifically a urologist. This is paramount. They can accurately diagnose your condition, roll out more serious issues like prostate cancer, and help you create a personalized, evidence-based treatment plan that's right for you. Please don't self-diagnose, and certainly don't rely solely on unproven remedies. Your health is far too important. You've heard the your power, your choice. Balancing natural support with medical wisdom and call to action truth today. The desire for natural relief from an enlarged prostate is deeply understandable, and while simple remedies like castor oil packs might offer some localized comfort and support general well-being, it is crucial to understand they do not shrink your prostate or replace proven medical treatments. True vitality after 60 comes from a balanced approach, embracing lifestyle changes, being open to effective medications when needed, and most importantly, maintaining a proactive relationship with your healthcare provider. The choice is now yours. Will you chase unverified claims, or will you seize this moment to actively shape your future with intentional science-backed choices? So here is my direct, unwavering challenge. First, internalize this profound truth. Integrate complementary natural practices for comfort and well-being, but always ground your primary treatment in science. Second, commit to a scheduling that checkup with your doctor or urologist if you're experiencing prostate symptoms. This is the first, most critical step. Third, approach this journey with newfound clarity, unwavering confidence, and the fierce determination of a man who knows what he deserves. Don't just wish for relief from an enlarged prostate gentleman. Actively secure it with wisdom and clear action starting today. It will help you understand your symptoms and prepare for your doctor's visit. Subscribe to Vitality for Gentlemen now. It's time to reclaim the powerful, vibrant man you were always meant to be. Hit that notification bell so you don't miss our next essential video offering more direct strategies for male vitality. Drop a comment below. Tell me your biggest takeaway or how you feel. Now, your journey is our shared mission. Until next time, this is Dr. Christina Morgan reminding you that true masculine power is built, nurtured, and fearlessly reclaimed. Go forth, gentlemen, and embody your strength.